Utilization nurse for over 9 years. I have 2 years experience at the bedside, and I have worked for 3 different companies. The goal of my channel is to help nurses pivot from the bedside to remote work. This company is called Centerwell, and they are hiring a care manager. This is telephonic nurse, part-time. This is remote and nationwide. And a little bit about the position. This is a part-time position, and you will work 20 hours per week, and you have 2 options for your shift. The first option is 7 a.m. to 12 p.m. Eastern Time, and that's every Monday, Tuesday, Wednesday, and Saturday. And option 2 is 7 a.m. to 12 p.m. Eastern Time, and that is every Wednesday, Thursday, Friday, and Saturday. And you are required to work every other holiday, and this is a work from home telephonic registered nurse position. So straight to the qualifications. You must have an associate's degree, which is required. A BSN is preferred. We require a compact state RN license. Business needs may require additional state licensures to be obtained. At least 3 years post-acute experience. Home health or hospice experience is preferred. Nursing background, working across multiple areas of post-acute care. Nursing experience in post-acute care. Current CPR certification. The jobs I have worked remotely has never asked for a CPR certification. You're working from home. There's no one you're going to be performing CPR on besides whoever lives with you. So this is sometimes you'll see this. I don't understand the logic behind it, but it just sometimes exists. Knowledge of home health, hospice, and palliative care services. Ability to learn and master information related to locations and services of clients. Excellent analytical and problem-solving skills, excellent verbal and interpersonal skills, communicate effectively with empathy over the phone, and must read, write, and speak fluent English. And they want you to have a minimum of download speed of 25 megabits per second, and an upload speed of 10 megabits per second is required. You either have the wireless, wired cable, or DSL connection is suggested. Now, satellite, cellular, and microwave connection can be used only if approved by leadership. Employees who live and work from home in the state of California, Illinois, Montana, or South Dakota will be provided with a bi-weekly payment for their internet expenses. And home or hybrid home office employees will be provided with telephone equipment appropriate to meet the business requirements of the position for the position or job. Now, the jobs I've worked, the phones are automatically just embedded into the computer, your laptop. So let's say, for example, the phone system is it's through Microsoft Teams. So you can actually make and receive phone calls from Microsoft Teams. That's not only internally to your coworkers, but also externally to providers and hospitals. And last but not least, work from a dedicated space lacking ongoing interruptions to protect member PHI and HIPAA information. It just means they want you to make sure you work in a room that has a door that does lock. And they do mention here travel, or this is a remote position. Occasional travel to Humana's offices for training or meetings may be required. And UMass Memorial Health has 2 jobs available, and they are also best in state employers and best employers for women. The first job is a licensed practical nurse. This is advanced therapeutics. It is a 40-hour work week. It is remote. It was posted today, and this job pay range is between $28.14 to $41.12 per hour. You will work from Monday through Friday, 8:30 a.m. to 5 p.m., and you work a day shift, and it's an 8-hour day. Now, this position has the requirements of you must have a current and active LPN license, a minimum of 2 years of clinical experience that can be ambulatory, primary care, specialty, or telehealth is preferred, strong communication and patient education skills, ability to work independently in a remote environment, and proficiency with telehealth technologies and remote patient communication. Also prefer that you have experience with supporting patients with chronic disease management, clinical patient triage and symptom assessment evaluation, and familiarity with electronic medical record systems, preferably Epic. So just make sure that you have Epic on your resume maybe you can just put platforms on your resume and then put all the platforms you are familiar with So if it's Epic, Cerner, Meditech, Microsoft Office, etc., just make sure you place Epic somewhere on your resume. This next job is for a supervisor, nursing operations, advanced therapeutics. It's a 40-hour work week. It is remote. And let's see, back to the top. This is full-time. It was posted 5 days ago. And the pay range is $83,000 to $149,000. The work week will be from Monday to Friday. You work the day shift and an 8-hour day, 40 hours a week. This position has the requirements of a current bachelor's degree in nursing, current Massachusetts nursing licensure and registration. They want you to have a minimum of 3 to 5 years of clinical experience in ambulatory specialty or chronic disease management settings, demonstrated leadership experience in ambulatory practice, sound knowledge of current general nursing theories and techniques, excellent communication, problem solving and organizational skills, and just make sure you put Epic and whatever platforms you're familiar with on your resume. And it wants you to make sure you have familiarity with quality improvement methodologies, and ambulatory care experience is preferred. Care Access is hiring a registered nurse, clinical delivery. This is a USA remote position. A little bit about Care Access. Care Access is working to make the future of health better for all, with hundreds of research locations, mobile clinics, and clinicians across the globe. We bring world-class research and health services directly to communities that often face barriers to care. We are dedicated to ensuring that every person has the opportunity to understand their health, access the care they need, and contribute to the medical breakthroughs of tomorrow. So this job is for an RN, and the qualifications or requirements are an active RN licensure with a commitment to compliance and regulatory standards. Compact licensure is required. Additional licenses may be required in addition. A BSN or equivalent degree is preferred. They want you to have a minimum of 3 years of experience as a working nurse, clinical research, medical communications, and our related field, proficiency in Salesforce or other EMR systems, electronic medical records, so that if you have Epic, Meditech, Cerner, etc., make sure that it is placed on your resume. EMR systems for documenting patient interactions, licensure requirement. Compact licensure is required. Non-pack state license is preferred. Willingness to maintain and obtain additional state licenses as needed. Must hold all licenses in good standing. Compact states. 42. RNs with compact licenses can practice in all 42 states in the compact, including Alabama, Arizona, Arkansas, Colorado, Florida, Texas, and more. Non-compact states, that's 8. California, Nevada, Illinois, Hawaii, Alaska, Oregon, Minnesota, and New York. And the location for this job, it is remote within the United States, and this role does require 100% of the work to be performed in a remote office environment. Comfort Medical is seeking a clinical nurse reviewer, and this is the United States. The quality assurance is a job family, and for this position, the requirements are a college degree in healthcare, nursing, or related fields, a minimum of 2 years experience working as a clinical nurse reviewer, or in utilization management, must have an active LPN or RN certification in the state in which they reside, and you must maintain certification, ability to work collaboratively and independently and stay on task, strong background knowledge in healthcare regulatory, government policy, and contracted payor policy, excellent medical terminology skills, and excellent written and verbal communication skills. Now, the preferred qualifications are 5+ years of DME, that is durable medical equipment, which is your oxygen tanks, walkers, crutches, any kind of equipment that you would actually use for medical purposes. So DME industry experience, that is your neurological or ostomy, EHR, that is electronic health record system experience, and certified professional in healthcare quality. And this is not a qualification, it's just preferred qualifications, so it's actually not mandatory. And just one more thing, at Coloplast, which is also Comfort Medical, We believe in recognizing and rewarding the contributions of our employees. Our total rewards package is designed to support your well-being, foster your professional growth, and ensure a healthy work-life balance. Every health is looking for a utilization review nurse, RN. Now, for this position, they do require a little bit more information from you. So we're going to go straight to the requirements. They want you to have previous healthcare or managed care appeals experience. You must have a current, unrestricted Texas nursing license or compact license. And they want you to please include your license number and the corresponding state or states in your resume. So what you can do if you don't have that information at hand, the easiest way to look for your auditor's licensure is to go to nurses.com. That is www.nursys.com. And right here, click on Quick Confirm or look up your license and just type in your name. It likes also your first and last name as well as which state you want to look up, and as well as if you are LPN or RN. I'm going to click on agree here. I'm going to say no thanks, I don't want to see that. So just enter your name, first and last name, and license type. So you have practical nurse, registered nurse, so on and so forth, and state. Now, even though if you have multiple licenses in different states, whichever one you choose, whichever state, it will show up all licenses you've have currently and any prior licenses. So if you moved around from different states, it will show your previous licenses and that those licenses have expired due to maybe you just didn't renew, or if you decide to move to a different state and you have a new license. So back to the position, they also want you to have a diploma from an accredited school or college of nursing is required. You have 1 to 2 years of experience working at a health plan performing utilization management using standard practice guidelines. You have working knowledge of medical and insurance industry terminology, including basic level of CPT, ICD-10, authorizations, digital health programs, NCQA, or URAC standards. Now, regarding this information here, you will learn about this, even though they want you to have experience. You will learn about this on the job regarding the CPT codes and ICD-10 codes. And all we do is whenever we're looking for a certain code, we just type in, let's say hypertension ICD-10. I know that one by memory. That the ICD-10 code for hypertension is I-10. So if there's any kind of code you're trying to find, you can always just Google it online, and it's easy to find. You have 3 to 5 years of clinical experience in a hospital or ambulatory setting, assisting with direct patient care. And just an FYI, I only have 2 years bedside experience. You have a passion for quality, teamwork, problem solving, and critical thinking. You can work independently and comfortable in a fast-paced, deadline-oriented, tech-savvy work environment. I do want to also stress that for your resume, make sure you focus on what you did, why it's important, as well as how it relates to the job that you want. And you also want to include your tech savviness in the job. So I would say make sure you include a list of your platforms. So whatever platforms you use at your current job and previous jobs, include those platforms. So that's Meditech, Cerner, Protouch, what else? And Microsoft Office. Any kind of platforms that were only internal to that job, as well as well-known platforms, include that on your resume. You want to include your tech savviness on the job as a bedside nurse, or whatever kind of nurse you are currently. You have an area of interest or experience with cardiology or pulmonology, women's health, orthopedic surgery, or physical medicine, primary care or pediatrics, and oncology. You have experience outreaching and educating members telephonically. I would say for your resume, you want to stress that you have the outreaching and educational background of communicating to your patients. You have an innovative and entrepreneurial spirit with a passion to contribute to a much needed change in our healthcare system. And a bonus if you have familiarity with Salesforce, Health Cloud, and Care IQ. I've heard of this one, but I've never used Salesforce. I've not heard of the other two, Health Cloud or Care IQ. Bonus if you have a CCM or ACM certification and an MCG certification. And there's also a website you can go to get MCG certification. And you'll find certification courses. Now these courses are $200 per course. And I would suggest if you were to take one of these courses, I would suggest, not this one, this is behavioral health, you don't want that one. Let's see, you don't want certification, you don't want medical director, that's for doctors, and that's for doctors as well. Specialist, that's behavioral health, you don't want that one. And let's see, maybe this one, they actually added more. Okay, so the one you would want is I just passed it up. Medical Care, MCG Care Guidelines Specialist Certification, that's ISC, as inpatient and surgical care, and GRC, which is General Recovery Care Guidelines. I do have, I believe it's a year and a half or 2 years experience using MCG. The very first company I worked for started with Interqual and then went to MCG for about 2 years or less and then back to Interqual. The only thing I've noticed the difference between Interqual and MCG is that MCG allows you to approve authorizations easier. You just click on maybe one or two options and you approve it just like that. For Interqual, it takes more work to get these authorizations to be approved. So if you were to decide to take any kind of MCG courses, I would suggest this one. Looks like it's actually a 13-week course. It's online. But if you were wanting to get certification just to help you with your, let's say, getting a job, getting an interview for a remote nurse, I would suggest this one. So back to the job description and bonus if you have appeals experience. And here are your telecommuting requirements. So this is a remote position. Our whole company works remotely. The company headquarters are in Dallas, Texas. The business hours are weekdays 9 to 5 Central Standard Time. We only consider candidates in the USA who reside in Central Time or Eastern Time zones. This position requires work during the stated business hours as well as rotating on-call weekends for utilization review cases. Now that's common to have rotating weekends. The one company I worked for, the weekends and holidays was only voluntary unless they didn't have enough nurses who volunteered for the weekend and holidays, and then it would just get told you basically based on seniority. And another company I've worked for, these last two companies, they automatically have you work 1 weekend a month, and the holidays are rotational. But I always volunteer for the holidays, so I don't mind working every holiday because I don't have any kids, and people with children, to me, they should be with their kids. But most companies do have the weekends and holidays on a rotational basis. They also require you to have a dedicated work area established that is separate from other living areas and provides information privacy. So this basically means it's HIPAA compliant. You want to make sure your office or wherever you're working is a room with a door that does lock. And ability to keep all company-sensitive documents secure, and must live in a location that receives an existing high-speed internet connection service. And the next position with Every Help is a care coordination RN. You must be bilingual in Spanish. And for this position, the requirements are Spanish fluency is as conversational as required. You must have 1 to 2 years of experience working at a health plan, preferably with a commercial population. You have 3 to 5 years of nursing experience in a clinical setting, assisting with direct patient care, such as a hospital or ambulatory setting. You have a current unrestricted Texas nursing license or compact license, and they want you to also include your license number and the corresponding states in your resume. And you can find the information on this website, nurses.com. Also, just an FYI, just in case you do get a resume, sometimes the hiring manager will request documentation of your nurse licensure, that it is active and unrestricted. So what you can also do is whenever you look up information here, you can send the hiring manager or the HR person, whoever's requesting it, a screenshot of your license information. They can find themselves, but for some reason they just prefer you just looking up for them. Back to the job, and diploma from an accredited school or college of nursing is required. You have working knowledge of medical and insurance industry terminology, including basic understanding of health plan benefits, which is CPT, ICD-10, authorizations, and digital health programs. You have an area of interest or experience within cardiology or pulmonology, women's health, orthopedic surgery, physical medicine, primary care or pediatrics, and oncology. You have experience outreaching and educating members telephonically, and you're outreaching and educating members or patients in person. So just when you just want to transfer that knowledge and that experience to make it where your resume makes it sound like it's telephonically as well. Let's say you're calling a patient's family members and you're educating him or her about the patient's care. You have an innovative and entrepreneurial spirit with a passion to contribute to a much needed change in our healthcare system. And bonus, like the previous job, is familiarity with Salesforce, our Health Cloud, our Care IQ, and the bonus is experience working in a call center. So just make sure that whenever you are applying to these jobs, you focus on these three things: what you did, why it's important, and how it relates to the job that you want.